Time now for our weekly medical rundown with ABC News medical contributor and pediatrician at Stanford Children's Health, Dr. Alok Patel. He's got several important stories to talk about, and we are starting, Doctor, thanks for joining us, with a record number of outbreaks on cruise ships. We don't like to hear this. The U.S. is seeing the highest number of outbreaks on cruise ships since 2007. We know a lot of Americans really love their cruises. So what is the main culprit here?
You know, Rhiannon, the big culprit in these cruise ship outbreaks is norovirus, which is a very contagious, nasty stomach bug that can cause diarrhea, vomiting, abdominal cramps. I know that is not a very pleasant topic to discuss, but make cruise ships in these outbreaks basically be a PSA for hand washing and hygiene, which is so important when people are gathered together in close boundaries and they're sharing things like utensils, buffet tables, and dance floors.
So what can you do to avoid an outbreak if you're on a cruise ship?
I seriously think the most important thing, it should be mandatory, is good hand washing, sanitation, wiping down surfaces, whether that's a doorknob, that's your cell phone, everything. And also, if you have any symptoms at all, please realize how contagious this nasty stomach bug is and stay away from others and encourage people to do the same. We talk a lot about cruise ships, Rhiannon, but this can happen anywhere. This can happen in hospitals and schools and colleges, anywhere where people are gathering together.
Be hyper vigilant. Okay, let's talk about the FDA approving a new version of the abortion pill. What can you tell us about that?
This is a generic version of the mifepristone 200 milligram pill, which is usually one of two pills that people take for medication abortions. Now, yes, the topic of abortions has been greatly politicized, but the fact is that 2/3 of abortions are done via medication. This is another version of that. And these are available in many states when you don't actually need to see a healthcare professional in person, but you can via telehealth. I want to remind people that mifepristone was approved by the FDA in the year 2000 and has a very safe track record. So while we wait to see what's going to really happen with this approval and a potential review that the FDA said they were going to do about mifepristone, we remind people about access, about safety, and about the fact that this availability might depend on your state in terms of regulations.
Good point there. It is Breast Cancer Awareness Month, of course, October. Break down the latest for our viewers there.
You know, the harrowing statistics about breast cancer is this is the most common cancer among women worldwide. This year alone in the United States, there'll be over 300,000 diagnoses, over 40,000 deaths. The good news is there's about a 92% survival rate. I hope this month we celebrate more stories about people getting tested, getting screened, and survivorship. We pass those stories of hope. We empower people to understand those lifestyle risks, such as maintaining a healthy weight, not drinking, not smoking, and getting in to get screening and mammograms early. May all these stories empower women to do best to take care of their health, for their communities, their friends, their family, and we tell more stories about equity and how you can take control of health in your own hands.
Raising awareness, that is key. Lastly, it is Friday, so what is your prescription for the weekend?
My prescription is relating to this government shutdown that a lot of people have questions about and how this may affect our healthcare. So when you don't have funding going to our healthcare system, you may see delays because of delays in reimbursements and payments and these public health officials not working. So what can you do? Make sure you know your health insurance plan and your premiums. Those might increase, so know what you're up against. Also, prepare early, get supplies and medications now, prepare for delays, and there are some federal programs that might be cut, such as SNAP, such as WIC, such as telehealth services through Medicare. So if you need anything, talk to your healthcare professional team about options. We've got your back.
Thank you for that. We know you do, Dr. Patel.